Back pain is very common. Back pain is often caused by strain, injury, to the muscles or tendons in the back. Arthritis, structural problems, and disc injuries are other causes. Pain often improves with rest, physical therapy, and/or medication. What is back pain? Back pain affects the lumbar region of the spine or back. It can be caused by a variety of injuries and conditions. Most often, it is caused by injuries to the muscles or tendons in the back. Almost everyone experiences back pain at some point in their lives. The pain can range from mild to severe. In most cases, it is temporary. However, long-lasting, chronic back pain is also common. Up to 23% of adults worldwide have chronic back pain. In extreme cases, back pain can make it difficult or impossible to walk, sleep, work, or perform daily activities. Given how common back pain is, it can be difficult to tell if you should be concerned. If something feels wrong or if the pain prevents you from doing your usual activities, trust your gut and contact your healthcare provider. Symptoms of back pain: they can range from a dull ache to a stabbing or shooting pain. The pain can make it difficult to move or stand up straight. Pain that comes on suddenly is acute. It can occur with sports or heavy lifting. Pain that lasts more than 3 months is considered chronic. If your pain doesn't get better within 72 hours, you should see a doctor. Symptoms that require urgent care: see a healthcare professional anytime you have back pain after a fall or injury. The same goes for problems with bowel or bladder control, leg weakness, fever, or pain when you cough or urinate. Muscle strain or sciatica muscle strain is often the cause of back pain from heavy lifting or strenuous exercise. But sometimes it can be due to the small jelly-filled discs that protect the space between your vertebrae. If one of these discs bulges or breaks, it can put pressure on a nerve. If it's the sciatic nerve, the pain will travel down your buttocks and down one leg. This is sciatica. You may carry a purse, backpack, or briefcase on your shoulder, but your lower back is what supports your upper body. This includes the extra weight you carry. So if you're carrying too much, it can put a strain on your back, especially if you're carrying it every day. If you have to carry heavy items, consider switching to a wheeled briefcase. Exercise: overworking your muscles at the gym or on the golf course is one of the most common causes of back pain. If you're inactive during the week and then spend hours at the gym or softball field on the weekends, you're especially vulnerable. Posture moms were right when they said, stand up straight. Your back supports your weight best when you're not hunched over. That means sitting with your back and shoulders well supported and your feet on a low chair. When you're standing, distribute your weight evenly between your feet. Herniated discs: the vertebrae in your spine are cushioned by gel-like discs that can wear away with age or injury. A weakened disc can rupture or bulge out, putting pressure on your spinal nerve roots. This is called a herniated disc and can cause severe pain. Chronic conditions: several chronic conditions can cause back pain. Spinal stenosis narrows the space around the spinal cord, putting pressure on the spinal nerves. Ankylosing spondylitis causes inflammation in the joints of the spine, sometimes in the shoulders, hips, ribs, and other areas. It causes chronic back pain and stiffness. In severe cases, the vertebrae begin to fuse, grow together. Fibromyalgia causes widespread muscle pain, including back pain. What are some common causes of back pain? Spine arthritis: slow degeneration of the spinal joints is the most common cause of back pain. We all experience wear and tear as we age, and it's normal for back pain to begin to develop as we age. When the cartilage between the spinal joints breaks down, it can cause inflammation in the surrounding tissues. Inflammation and thinning of the cartilage can increase friction in the joints, which can lead to back pain. Back injuries: a bad fall or car accident can cause a back injury, but so can carrying a laundry basket up the stairs. Back injuries can be sudden and shocking, or they can develop slowly over time. You might think that athletes and active people are the most likely to suffer injuries because of their active lifestyles. But that's not always the case, says Chatre. You're more likely to twist your back when you bend over to pick up socks from under the bed. Or you could do something as mundane as picking up a child, which can lead to back injuries. Herniated discs: a herniated or bulging disc is a disc that has leaked from its lining. This most often occurs in the lower back. An injured disc doesn't always hurt. But even if it doesn't, its contents can press on or irritate nearby nerves, causing pain in the lower back and other areas. Can your back pain be related to the weather? If your back pain seems to get worse on cold days or when the weather changes, you're not imagining things. Back pain can actually be related to barometric pressure and the temperature outside. Changes in pressure can sometimes cause pain in arthritic joints, including the spine. Muscles and joints generally respond to the environment by becoming stiffer and more prone to injury. Can back pain be kidney pain? Of course it can. The kidneys are located in the back of the body, and kidney pain can sometimes feel like back pain. The only way to tell the difference is to see a doctor who can do a thorough examination. What does it mean when back pain radiates down the leg? Back pain can radiate to other parts of the body, up or down from its original location. Sometimes back pain can be on one side of the back, which is normal. If pain radiates from the back down one or both legs, it may be sciatica, neuralgia, but this is not always the case. There are many areas in the lumbar spine that can cause pain to radiate down the leg, such as the facet joints, sacroiliac joints, muscle or bursitis. Can back pain be a sign of something more serious, like cancer? Back pain can be related to cancer. In fact, it is one of the first symptoms of prostate cancer when it spreads and creates lesions. Almost any cancer can spread to the back, and some cancers, such as sarcomas, can start in the back. Be especially careful if you have other symptoms in addition to back pain. If you have additional symptoms or concerns, talk to your doctor. What can you do for back pain at home? If your back pain is just starting, the best thing you can do is start keeping a journal. Write down your symptoms, times, dates, and activities that trigger, worsen, or improve your pain. If your pain doesn't go away on its own, take this information to your family doctor. This will make it much easier to diagnose the cause. Once you know what movements or positions are causing your back pain, try avoiding them and see if you feel better. Applying ice to the sore area can also help. So can over-the-counter pain relievers, which help reduce inflammation. Remember, pain relievers only treat the symptom of pain, not the cause.